Welcome back to Inside the Studio for this very special quarantine edition. We've got a very special program for you today. My guest today got her Bachelor's of Health Sciences and MBA at the University of Redlands in 1990. She has served as the CEO of Dignity Health Sacramento Division for the past 6 years. I'm looking forward to hearing her thoughts on the current pandemic situation and also her time at Redlands and how that translated into her career. Laurie Harting, welcome to Inside the Studio.
Hi, thank you. It's great to be here.
So we have a lot of questions to get to in just a moment, but as a housekeeping matter for those who are joining us, I want to invite you to ask some questions in that Q&A box, and we'll get to them over the course of this interview. And now before I get to the questions I have for you, how are you doing during this pandemic situation? How are you holding up?
Oh, I'm holding up very well. It's been the busiest time of my career, actually, going through this, what was a surge, and now the recovery phase of COVID-19. So doing well, but it's been quite a journey.
Are you working from home?
I am. Yes, I've had to work from home. All of the hospitals, I have 6 hospitals here in the Sacramento division. And of course, the staff are all working on site there, but our divisional station in Rancho Cordova, we had to close that. So I am working from home, but doing fine. Fortunately for a good virtual communication and a lot of conferencing through video. It's been quite interesting and learning process, but we're getting very proficient now.
Tell me about how Dignity is doing during this time.
Sure. So, well, all of our hospitals have been tremendously impacted. When COVID started about 6 weeks ago, we started seeing the patients arriving. We didn't have any designated hotspots, but we were watching New York City very closely, and obviously we're very fearful that we would have a surge like New York. So we quickly put the shelter in place into action right away. The governor here in California, Governor Newsom, was very proactive in making sure that we shut everything down quickly. As a result, we have not seen the same kind of surge that New York has felt. We've been very busy. Some of our markets busier than others. LA, for example, has been hit quite hard, but up here in Northern California, we've been able to manage it very well. But as a result, we have not been able to do as many surgical cases. All of the elective cases have been canceled. So from that aspect, our hospitals are sitting at half empty. We're not doing the surgeries which generate the revenue, and that's a challenge. So clearly our focus right now is how can we, when the governor opens the door and says we can open for surgeries, how can we start ramping that business back up?
So let's talk about those hot spots that you just mentioned. Healthcare workers have been testing positive in high numbers because of their exposure to coronavirus as they treat those patients. We've also seen healthcare workers protesting for more personal protective equipment. So what steps are you taking to listen to those concerns, support their mental health, and provide a safe working environment for your employees?
Yeah, that's a great question. You know, this pandemic hit, and it started obviously in Wuhan, China, right? Well, China is the producer of surgical equipment and supplies. And Wuhan is the center of China. So when they shut down that country and stopped producing all of their supplies, clearly that had an impact on the entire nation. And we are still feeling that impact, but it's opening up now. We're starting to get shipments. That has been our top priority, is to be at the top of the chain so that when supplies come, that we have the first supplies coming to our facilities. We've been very fortunate. Common Spirit Health does have a large presence. We have a lot of good contacts with vendors, both local and national and international. So we have been able to keep up with their supplies, but that is the biggest challenge. As far as the employees being exposed, that's something that we have taken a lot of precautions on to make sure that our employees are prepared and understand how to put on and take off the supplies and the equipment so that there's less chance of contamination. And I'm proud to say, as a result, we only have 3 employees to date after 6 weeks of having all of these COVID patients who have tested positive, and we cannot confirm if it's community acquired or work related. So we're just taking it on as a work related type of injury. 2 out of the 3 are fine. They've recovered fully. The other one is still in the recovery phase.
So let me ask you this, is where we are right now, are people that need to go to the hospital for other reasons more or less afraid to go to the hospital to get that care?
Right. So, of course, there's the news today. You turn on any news, and that's all they talk about is COVID-19. And so, of course, there's a level of fear that the public has right now about going into any hospital. So we have seen our emergency room volumes just drop considerably. All of the patients who have normal health problems that would come in, see their doctor, possibly come in for a procedure, we're seeing a decline in those numbers. And that's actually worrisome because people are staying home and maybe getting sicker so that when they do have to come to the hospital, it's more complicated than if they came earlier. So a message I would like to make sure is delivered is to continue to take care of yourself. Continue to reach out to your physicians. If you have chest pain and you think it could be cardiac related, come to the emergency department because it is safe. It is safe. We cohort the COVID patients away from the mass population. So we screen everybody before they arrive into the building. We have a separate waiting area for anybody with respiratory disease or symptoms, and then we treat them separately so that there's no mingling of the air for the population. So I just encourage people to continue to use your healthcare systems.
And as you were preparing to do what you were just explaining about keeping them in different sections and the preparations for all of that, how long did that take? Were you involved in that process?
Yeah, obviously we coordinate that. So we have a division. So we have right now, or early on during the surge, we had daily calls where we were talking about issues as they came up with decisions as a division, and everybody implemented so that we were standardized. We are elected early on to separate COVID symptoms patients from everybody else, and that was a good call. We set up tents outside of our emergency departments. We staff the tents. That's where all patients are screened before entering the facility. And they still remain in place today. We probably will keep that going for some time into the future.
Although so many have suffered during this pandemic, there's also been a tremendous amount of support from the community who are eager to help and help those frontline healthcare workers, donating food, masks, other supplies. What generous offers have you received from the community, and how are you balancing that with the safety protocols that you have to make sure that those workers don't get sick from anything that was donated?
Great question. So, that has been, I would say, the most positive thing out of all of this. If there's anything positive, it is how our community is rallied together. Now healthcare workers come in every day, right, and take care of patients, and having a patient that has some kind of an infectious disease is not unusual. We're trained to do that in our nursing training, respiratory therapy training, etc. So we know how to take care of ourselves during those situations, but of course it's just more prevalent now. And so seeing the community acknowledged by providing food to our staff every week, each one of our hospitals is getting free food from a restaurant that's being donated to them, and thanking them. Signs are being erected on all of the gardens and grounds of the hospitals, thanking the healthcare heroes, they call them. And it's just so heartwarming to see that acknowledgement. Early on, when we had some news about masks and the shortage of masks, we had sewing bees. Women that were volunteering came together, bought material, and made all sorts of masks for our staff. Now, while that's not good in the infectious taking care of those patients. It is okay for wearing when you're just walking around and mainly protecting others from your own droplets. So, so just heartwarming to see the great support that we're getting from the entire.
Well, I want to hear more about that because, as you said, we all hear about the death and destruction on TV. What else is giving you hope during this time? What examples of workers doing heroic things have you seen with your own eyes? Tell us about some of those things.
Well, I mean, just every day when you see them come in, knowing they're taking care of a very infectious patient, right? Hearing the bad on the news, it kind of taints your emotions almost when you think that this is such a terrible, terrible disease, which it is. But I think when we get more data and we understand the virus more completely in the future, we'll find that the mortality rate is not that much worse than influenza. But you don't know that yet. And as long as you don't know something, there's that fear of the unknown. And every day I see our staff coming into work and it's okay and they're happy. The morale is better than it's been in months because they're so proud of the work they're doing and the care they're providing. We had a patient who actually is married to a nurse, one of our nurses. And they went on a wonderful trip to Egypt, a cruise, one of the early cases. And he came back and started having symptoms, ended up coming to our hospital, spent 3 weeks unconscious in the ICU on a ventilator, very, very sick, did not think he would. And our staff rallied behind. Now, the wife is one of our nurses, but had to stay home. So she wasn't even able to be with him during his terrible recovery. Didn't even know if he would be recovered. So helping her, and I saw the staff reach out to her to support her emotionally, as well as helping him. And I'm proud to say he's now home. We actually were able to provide him some of the experimental drugs that were first coming out, and he received some of that. He actually got better, and he's been discharged. And there was a big article in the paper yesterday, front page, just talking about the wonderful care our staff provided for him and for her. So those stories just mean so much. That's why we all go into healthcare to start with, right?
That's fantastic. Let's talk about more of the treatments that you're seeing provide promising results. What are you looking at right now?
There's all the drugs that we've been hearing about on the news, which we have access to and have been trying. And some work, some don't. So it's not 100%. Just recently, we were able to provide a patient with it's plasma, right? So it comes from a patient, it comes from someone who already had COVID-19. They built up the antibodies in their own body. You take the plasma and then you provide that to the sick patient, and it's supposed to hopefully speed up the healing process. And whether it's related to the plasma infusion or not, but our patient within 24 hours after getting that, we saw an improvement and actually is continuing to improve. So being a part of that, state-of-the-art research that's going on across the country, watching patients come through what you think they would never be able to survive, that's just remarkable and great that we can be a part of.
Absolutely. And what advice can you give the public to support those frontline healthcare workers who are going to battle every day?
Well, you can't tell them thank you enough, right? I think that if you live next door to someone who's a nurse or a doctor or a healthcare provider, and just tell them thank you. Just show that appreciation. Everybody needs that stroke once in a while, especially during this time. So I think that's very valuable.
Let's turn to your time at Redlands now and talk about that. How did you end up there?
Oh gosh. Well, it was a few years ago, and I knew that as I was looking at my career trajectory, I knew that I needed to have a master's degree if I wanted to move into more of an administrative role. At the time, I was a bedside nurse, right, and taking care of these patients in the ICU myself. So no, and I had to consciously make a decision. Did I want an MSN so I could go up that track of nursing leadership, or do I want to go more the MBA route? And I consciously chose the MBA. I knew that as a nurse, I needed to sit across from the CFO and be able to speak his language and be able to articulate with him what exactly I needed for my budget process, and et cetera. And I have to say it worked. I mean, I think that with my MBA and having the clinical background, that meshing of those two skill sets has really positioned me in a place where now here I am a CEO of 6 hospitals over an entire division. So it's been that preparation, that learning skill and understanding how to be able to face the males who generally are in the CEO roles for healthcare and be able to speak the same language. So it's been an advantage for me for sure.
Did you always want to be a CEO of a hospital system, or did that just come naturally?
Yeah, great question. No, I never envisioned myself being a CEO, to be honest. I love being a nurse, and nursing was just very exciting to me, but I always saw what needed to be done. I guess that's just part of my personality. So as I saw things that needed to be changed or improved, then it made me then go into more of a role where I could make a difference. And the more I saw that I could do, the more I wanted to continue to do to make those improvements. And so obviously that's leadership. I wrestled with that because I loved patient care. In the ICU, if you're taking care of 1, maybe 2 patients for a whole shift, you make a difference for those 2 lives, right? Significant difference for those 2 lives. But in a leadership role, I'm able to make a difference to the 100 nurses that work in that unit, or the entire patient population that's in there. So you have more impact in being a leader, and that's where I really got the value of moving into a role like this.
So what were some of the classes that you took, and do you remember the professors that you learned
My,
from?
no.
No?
Well, I remember the classes, and I remember some of the tough professors that
Like
we
who?
had. Yes, absolutely. I can't remember their names. I'm not going to tell you how many years ago that was. So. But it is a memory for sure. It was a tough time in my life. I was a single parent in an administrative job going to school. So it was kind of balancing with 2 little kids at that time to be able to manage all of that. But and I have to admit, I at times thought, yeah, I needed to pause and finish it later, but I stuck it through because I knew this was important for my future career and to be able to be the sole income to take care of those kids. So it was worth every ounce of pain that I went through.
There was a quote that I saw that was attributed to you. You said, "There's no way I would have ever been able to be a CEO without having the necessary education and appropriate degrees from a credible university like the University of Redlands." Have there been times throughout your career where you were just sitting there and it came to you that this wouldn't happen without that?
Oh, every day. Absolutely. There's no way I could have ever moved into a leadership role like I have without that education. That education truly opened many, many doors for me. I was very fortunate. The Whitehead program at University of Redlands, it was done. So I only had to physically go once a week, but there was a lot of work done during that week. But so it allowed for the working adult to continue on with the education. So I was very fortunate. University of Redlands has a very good reputation. Here I lived just 10 minutes away. So it was quite convenient to be so close to the university and to be able to take advantage of that program.
In 2006, you were one of 3 female hospital presidents in a region of Arizona at that time. It's hard to believe, but is that still the case for women in healthcare leadership, that they're considered pioneers? And what does it say about the system that you've had a front row seat to all these years?
Great question. Unfortunately, it is still the case. We've seen progress, and especially in Arizona, there was a lot of progress, and still is a lot of progress in seeing more women CEOs. Unfortunately, though, it's kind of slipped back, and so Dignity Health now merged with CHI, and we are Common Spirit Health. There are 3 women CEOs of divisions uh, out of 12 divisions. So you can see we're not even close to half, we're a third. So we've got a long ways to go. And I think that we clearly need to continue to pave that road for more women to move into senior leadership roles. And I'm a firm believer, I'm a mentor to many females moving into leadership, and I offer a lot of counsel to anybody that is interested. I get a lot of joy out of that, but I also like to watch them grow and prosper as well.
Well, talk to me about some of those mentors that you've taken on, and where have they gone on to?
Well, here in this division, there was a female in a COO role. I saw so much potential with her and moved her into a hospital president role shortly thereafter. She is one of my star performers here in Sacramento. So I'm very proud of that. I continue to give her guidance. Right now, there's a chief nurse executive that she has approached me and said someday she wants to become a CEO. What does she need to do? So I'm giving her some counsel and some guidance and coaching to help her to grow into those positions. So I can say I can look back in my career, and there are many female leaders who I have helped to move into a higher position. We still have contacts today.
Well, it looks like we covered everything because we don't have any questions, so I appreciate your time and your willingness to answer all of my questions, and I hope you're staying safe and healthy during this time. It was so great to meet you and talk with you about what you're doing. And I want to thank all of the viewers who joined us today as well, and I hope you stay safe and healthy, and we'll see you next time.